Slide 1 shows the testing capacity and the number of new cases. The top chart in the slide shows the number of tests, and that number of tests as of the 2nd of June was 135,643. This is different to testing capacity, which stands at just over 200,000. And as I said yesterday, this demonstrates that there is spare capacity in testing. And so if you have symptoms of coronavirus, that's a fever or a new dry cough or a change in your sense of taste or smell, then please do go and get a test from nhs.uk/coronavirus or by phoning 119. It's incredibly important that we can trace the virus by ensuring that anybody with symptoms has a test. And of course, we're rolling out testing across care homes and making sure that staff in hospitals get the opportunity to be tested as well. The bottom chart on the slide shows the number of confirmed cases. This is 1,613 as of, again, the 2nd of June, and brings the total of number of cases confirmed in the UK to 277,985. And although the 1,613 figure is slightly higher than yesterday, we can see that the 7-day rolling average continues to fall. Second slide, please. The data from hospitals show that those new admissions to hospitals in England has fallen to 436. This is down from 471 on the 24th of May, so just over a week ago, and down from a high of 3,121 on the 2nd of April. This figure of 436 admissions to hospitals in England with COVID-19 is the lowest figure since the 20th of March, and it demonstrates once again that we are making progress against this disease. Again, as yesterday, the proportion of mechanical ventilated beds that are occupied by patients with coronavirus remains at 9%. Next slide, please. Thank you. Just like yesterday, the number of people in hospital continues to fall. 7,607 are now in hospital with coronavirus, and that is falling broadly falling in each part of the country, but for a little bit of day-to-day movement in some of the areas. For instance, as you can see right at the end of the chart for the North East and Yorkshire, but we keep that very closely under review, but the overriding trend, as you can see, is downwards. The next slide is the number of deaths, and sadly, on the 2nd of June yesterday, 324 deaths with coronavirus were recorded, taking the total to 39,369. And we mourn each one of these. And we try to keep these data as accurate as possible, including where we find in the past, in some cases there are deaths where we discover that there has been a connection to coronavirus, and we add those into those data. So we can see that, again, the trend is broadly down, but there is still some way to go. And after the weekend effect, which we've seen each weekend in terms of the number of deaths recorded, because this is according to the date these are recorded, we've seen that rise on most Mondays. And sadly, the figure is 324 today. Next slide, final slide, please. The final slide reports on data from the Office for National Statistics, which was reported this morning, and reported a total of 48,106 deaths in the UK, where COVID-19 was mentioned on the death certificate. And you can see that this number is falling. The top chart shows those data. and shows where we were on the recorded daily deaths data for the period that corresponded to these data coming from the ONS. On the bottom chart, we can see the place of occurrence of those deaths, and you can see that both the number of deaths and the proportion of deaths that are in care homes, both of those are falling. 27.3% of deaths occurred in care homes in the latest ONS data to the week of the May the 22nd, bringing the proportion overall of deaths in care homes down to 32.5%. We don't capture in these charts, but we do capture in a report published by Public Health England today further data, some of which are much more troubling. The PHE investigation into the way in which the virus targets people unequally and disproportionately has been put on the website. And this is a particularly timely publication because right across the world, people are angry about racial injustice. And I get that. Black lives matter. And I want to say this to everyone who works in the NHS and in social care. I value the contribution that you make, everybody equally. And I want to say it right across society too. I want to thank you, and I want you to know that our whole country cares about your well-being. And I value too those who come to our country to work in the NHS and in social care. And I love that this country is one of the most welcoming and tolerant and diverse. That goes for the whole country, and it goes especially for the health and care system. As I said in the House of Commons earlier, PHE's investigation found that age is the biggest risk factor for coronavirus. Next, gender. Living in a city is a risk, and being black or from a minority ethnic background is also a significant risk factor. There is much more work to do to understand what's driving these disparities and how the different risk factors interact. And we are absolutely determined to get to the bottom of this and find ways of closing that gap. And I'm delighted that Kemi Badenoch, the Minister for Equalities, will be taking this work forward, working with PHE and many others. We value the contribution from everyone to fighting this virus. Everyone has a contribution to make.